Thank you so much for joining us. This is our next webinar in our health insurance education series, Medicaid denials. The slides are all going to be in English. If you want a Spanish version of the materials or want an English version of materials, you can go to the DSCC website and find all of the materials there. So about the presenters, my name is Brittany Provost. I'm the manager of DSCC's Benefit Management and Research team. We work directly with DSCC care coordination teams to help solve insurance problems. So if you are with DSCC and have a DSCC care coordinator, chances are, if there's been an insurance problem, we've been linked in and kind of helped the care team to work through those problems. And then I also have two of my team members here with me tonight, Gracia Vegas and Renee Woodson. So you'll hear from them throughout the presentation. Our agenda, I'm going to do just a very brief DSCC overview for anyone that's not familiar with DSCC. We're going to talk about what a denial is, just kind of review some general information about Medicaid coverage too, before we kind of go into what the maybe common types of denials are, how to avoid those, and kind of some tips and tricks. And then at the end, we'll have some time for questions. This is our vision: children and youth with special healthcare needs and their families will be the center of a seamless support system that improves the quality of their life. And our mission is that we partner with Illinois families and communities to help children and youth with special healthcare needs connect services and resources. And we have a few different programs. So if you're not familiar with DSCC, if you go on our website, you can read a little bit more about the different programs that we have and the populations that we serve. Always feel free to just send in a question if you are thinking that you or your child might qualify. We can always have our enrollment team have a conversation and kind of review your individual situation to see if you might qualify for DSCC services. Before I turn this over to Gracia to talk about like the denial and Medicaid stuff, I did want to put a disclaimer that we are not Medicaid, okay? We are presenting to all of you tonight with our experience and our knowledge to help hopefully make navigating some of these denial things and navigating Medicaid as a whole, which I know is a pretty big feat, easier. We do not make decisions about denials. We do not, have any say in the appeals process or any of those things. So I just wanted to put that disclaimer out there that we're just doing this to make sure that we can hopefully help all of you navigate this as best as possible. Okay, and with that, I will turn it over to Gracia.
Thank you, Brittany. So first, we're going to talk about what is a denial. This can be when Medicaid says no to paying for services you have already received. For example, if you went to a doctor's visit and you got a bill saying the service were not covered. A denial can also happen before you get the services that you're seeking. If your doctor or another provider sends in a prior authorization request, which is sometimes called the prior approval to Medicaid, and it's denied, that's also considered a denial. So it's important for just to keep that in mind of what a denial is and when that, who is the person who denies or who is the agency entity who denies the service. Avoiding denials. So this is, now we know what a denial is. So it's important that we also talk you through how to avoid getting the denial. So taking steps to prevent a denial or avoiding a denial can help save you and your loved ones a headache when dealing with all this. There are some important things that you can do to help avoiding the denial when requesting the services. An important step to avoiding denials is to first use providers that accept Medicaid or your Medicaid managed care plan, the MCO. If you're in a managed care plan, you must use doctors that are in network to the MCO. You should also know your health coverage, be familiar with what Medicaid covers, and know what might require prior approval and what might not require prior approval. And knowing the insurance network to use, and that would be, what doctors are part of who accept the Medicaid plan that you're on. Know what Medicaid covers. This also includes knowing when to get a prior approval. Your doctor or provider might also know this and can help you with submitting the prior approval prior to getting the services needed, and also as the individual calling to confirm that it is covered, so you won't get an unexpected bill or a denial in the future. So Medicaid out-of-pocket costs. It's important to know that for most Medicaid programs, you won't have any out-of-pocket costs or premiums. This includes copays that you might have for office visits, for services that you might seek, if it's a specialty service, for medications. And this is only true for doctors or providers who accept Medicaid and if services are covered by Medicaid. So that should be a red flag if you do go to a doctor's office and they do ask for a copayment, or if there's any out-of-pocket costs, that something's wrong, because there shouldn't be no copayments. Again, you won't have any out-of-pocket costs if you're using Medicaid enrolled providers or providers that are enrolled with the MCO plan. And if the service is not covered by Medicaid or your MCO, you would be responsible for the cost. So how to find a medical provider? Remember, you must use providers that accept Medicaid. This is a really important when in using in-network providers, so you can make sure that you won't have no out-of-pocket costs and expenses. If you have regular Medicaid, you call the health benefits hotline to help you find the provider. You could also utilize their online search to try to find a provider in your area that does accept Medicaid. If you are in a Medicaid managed care plan, you must use providers, again, that are in the network with your plan. And then also finding out if you need additional information, you call the member service number on the insurance card, and also utilizing the website so you could find a provider in your area for the specific service that you're seeking. Okay, so what does Medicaid cover? Part of avoiding a denial is to know what Medicaid does cover. If you know the Medicaid covers the services that your child needs, you'll have a better chance of it being approved and not getting any out-of-pocket costs. Medicaid provides benefits for many medical services like doctor's visits, vision, dental, and prescriptions. And we also, you can see more information on our, I believe, next slide or so that does have, additional information, and you'll also be provided towards at the end of our webinar, the information of what this Illinois Medicaid cover tip sheet. Medicaid also has coverage for other benefits like vision, dental, and prescription medications. Medicaid managed care plans, the MCOs, provides also the same services as regular Medicaid does, and it might also have additional benefits for their members. So something to just keep that in mind in case depending on what plan you have, from the traditional Medicaid to the MCOs. Medicaid or your managed care plan may need to give you special permissions to get certain services. This is called a prior authorization or prior approval again. There may also be limits that they set on the amount of an item that you can receive, and also a time frame of how often the participant could receive an item and it be covered by Medicaid. So this is what does the Illinois Medicaid cover handout that I mentioned. Like I said, we will post this on the website and the related resources for the family webinars after our session. And you can see that there are a lot of examples of what Medicaid covers. This list is not a complete list. It's just a guide. You could have it handy when you are thinking of what is possibly covered. You should know that some of the services require your child to have a specific medical need or diagnosis in order for Medicaid to cover it. And then I would like to point out something like diapers or formulas might be covered if your child has a medically diagnosis that requires them to use diapers or formulas past a certain age. So, for example, if your kid is in the stage of life where it would normally would be any child that's to be in diapers, that child would likely not. But if it's an older age child, like after 4 years of age or so, and that has a medical need for the Medicaid would cover those with a prior authorization and letter of medical necessity from the provider stating what's going on and the reason that they are needed. Those expenses, can add up quickly. So be sure to use your insurance to cover as much as of your care needs or your loved one's care needs as possible. And this tip sheet is also in Spanish, if needed. Okay. What is not covered by Medicaid? So we just talked about what we know is covered by Medicaid. And again, this is not a complete list, but we want to talk through a few things that we know are not covered by Medicaid, because knowing what isn't covered is also important, just to avoid any denials, potential denials. So services that are not medically necessary would be denied or not covered by Medicaid. Cosmetic services, service or items that are convenient to the caregiver. Also, services ordered or prescribed by a doctor that is not enrolled with the Medicaid program. They cannot cover services, medications or equipment that is an order by a doctor that, again, that is not enrolled with Medicaid. And then, for example, if you have Medicaid and private insurance, your doctor is enrolled with private insurance but not Medicaid, they could prescribe something, but however, you would have some out-of-pocket costs because Medicaid would not be able to cover their portion. So that's, but they could cover, the private insurance would cover that portion, but Medicaid just in general won't cover it. So there would be just an expense that the family and individual would be responsible for. And continuing on with what is not covered by Medicaid, Medicaid won't consider items that are fully electric, like a fully electric hospital bed or lift. You should definitely still explore those options with your provider, but just know that it's likely it will be denied, and they would recommend the partial electric option if that could meet yours or your child's needs. They won't cover something if they know that there is a most cost-effective option available out there. So also keeping that in mind. For example, if a regular bath chair will meet the need, Medicaid won't consider more specialized bath chair. And needing, if a more specialized one is needed or for any, anything particular, just knowing that the medical justification from the doctor will be required in order for it to be considered by Medicaid or the MCO. Items that might be available at a retail store like Walmart that could meet the need won't be covered. A good example of this is a regular 5-point harness car seat. If your child fits in a regular car seat and that meets their need, Medicaid likely won't consider a specialty car seat for them. Again, please ask your insurance to consider it, but just know there is a good chance it might be denied. And again, just want to remind everyone, like each person's situation is unique, so you can always try to have it considered by your insurance if it's something that is medically needed. So continue with what is not covered by Medicaid. Usually Medicaid will look to see if you have items that are similar to meet the need. So if they will often only cover one kind of mobility device. For example, if there's a wheelchair, or if you or your child have received a wheelchair and then you request a custom stroller, they will likely deny that as it being a duplicate because the wheelchair should meet the need. They would not cover items that they consider a convenience to the caregiver. This is often why they don't want to cover full electronic items because it's more of a convenience than a need. And there isn't often enough medical necessity to prove why an electric item is needed for that medical condition. And these items, again, are seen as convenience to the caregiver. Medicaid will not cover things as a stair climber or a Scout-Mobile for the external stairs. They will consider it if there are internal stairs inside the home. If there are only external stairs, it will not be considered. And then they will not cover vehicles or home modifications. It is important to know that some specialty equipment or modifications could be covered by Medicaid waiver program if your child's eligible. We do not have time tonight to talk about the different waiver programs, but you can review the link after you get the slides to read more about it. Medicaid and other insurances. So, okay, now let's talk about what happens when you do have Medicaid and other insurances. First, it's important to know that you can have Medicaid and other insurances like private insurance, Medicare, or TRICARE, which is military insurance. You just have to qualify for Medicaid and you can keep your other insurance as well. Your other insurance will pay for service first and Medicaid will pay second. So it'd be also known as a secondary. Medicaid would become the secondary payer of services. And then sometimes some participants or individuals are eligible for health insurance premium payment program, also known as HIP, which once you get the presentation, you could click on this link to get the additional information of the HIP program. Okay, so with Medicaid and other insurances, you must also, like I had mentioned briefly, you must follow both insurance rules. So using in-network providers that not only accept the private insurance, but also accept the Medicaid, getting a referral when required, and that would be two referrals. No, sorry, I apologize. So it'd be one referral, but I'm getting the prior authorization. So getting a prior authorization when required would be needing two because you would need, a provider would need to submit one to the insurance, the private insurance, but also Medicaid. So there's cases where you might not need perhaps a prior authorization for one or the other. If services are covered by Medicaid, you should not be charged co-pays or deductibles for co-insurances for your other insurance. So definitely, again, if it's private insurance and you have Medicaid, there shouldn't be no deductibles, no any out-of-pocket costs. And then you must tell Medicaid if you have other insurance as well, though. So as the client for the provider, just making sure that they are aware that you have, not only one insurance, but two, if that's the case for you. Updated Medicaid with other insurances. So when an individual does have private insurance, it's just important, like I mentioned, that Medicaid is aware of it, and that could be done it's quickly just by calling the third-party liability update line. So third-party liability is also known as the third-party insurance liability line. You could call, and then you would have to just provide your Medicaid number for each member who has private insurance, along with insurance information ready to provide it to them. They have an English option and also a Spanish if needed. And then you would also press the number 4 for the third party liability line. And also if you prefer to send an email, you could submit one to them and attach, you would provide, the member's name, Medicaid number, and the insurance information, but it's also very helpful if you could attach the insurance card to the email. So like that, they could review the numbers and they know that they're correct. And there's no typo. So from here, I'm going to hand it over to Renee, who will go with understanding denials.
Hello. I'm Renee, and I'm going to talk a little bit about denials. And I'm going to talk about first understanding denials. And it's important for you to understand why Medicaid or your managed care plan said no to whatever service you were trying to get. You may get a letter from Medicaid or your managed care plan that says why the service was denied. This can happen before or after the service is received. Your doctor, provider, or pharmacy might also have information on why something was denied. Okay, now we're going to talk a little bit about common denials. These are just some of the general denials you might see. First of all, we're going to talk about mistake or error. This is usually when the provider or whatever, the physician, the hospital, DME provider, they've made a billing error. In this case, this can be fixed by calling the provider and confirming that they have your right insurance information. Most of the time, that is it. They may have an old Medicaid number, or maybe you were in an Aetna MCO and now you've changed to Blue Cross Blue Shield MCO. So just make sure they have the correct information. Next, one of the common denials is treatment is not medically necessary. When this happens, it is due to maybe you saying there was something or a service that you needed, but according to the physician, I'm sorry, according to Medicaid, they feel like this service was not medically necessary. So they may say this before the service or after the service was rendered. And what will happen is the doctor usually will have to send in more information to say, hey, this is why this is needed. Okay, another one is drug is not on the formulary list. Now, Medicaid has a list of medications that they usually like for you to use. And if you don't use that one, that could cause, if you don't get that specific medication that's on that list, that could cause a denial. So usually your insurance, like I said, they only want you to use a certain medication, and they may require the doctor to tell them, hey, why do you need this one instead of the one that's on the formulary list? Okay, the next one is care at an out of network facility or provider. We have in-network providers. Those are people that are enrolled with Illinois Medicaid. So usually if they are not enrolled with Illinois Medicaid, that means they are out of network and Medicaid will not pay them. So that may, if it's a special circumstance, you may have to get a prior authorization, may have to get permission or something. But in most cases, if it's out of network, those services will not be covered. And then also services not covered. And so that may be something that maybe you received a service and it's just sometimes services are just not covered. Some things Medicaid just won't cover. That's why it's always good to call first. Call your plan. Call Medicaid or call your MCO plan to find out, hey, is this covered or is there certain requirements for this? And I forgot, I skipped the one about the pre-authorization. That's where the pre-authorization comes in. That may require pre-authorization. It may require extra information before you can get this service rendered. Okay, and a few more. No insurance information on file or incorrect insurance on file. Again, this is where they may have your old information. They're going to bill what's in the system. So try to make it a habit of showing your new card. If you show every time you go to the pharmacy or every time you go to the doctor's office, show them your card to make sure they have the most current information on file. Okay. Oh, these are, and I'm sorry, these are also, this is for the pharmacy. These are common pharmacy denials. And we often see a lot of these pharmacy denials for various reasons. Here are some of them. Refill too soon. So maybe you have a prescription that you can only fill every 30 days and you try to get it filled sooner than that. That is going to cause it to deny as a refill too soon. A prior approval needed. As we said in the previous slide, a prior approval needed or not needed. Also, if a prior approval is needed, it means they need, that extra information or whatnot before you can get this medication. Sometimes they may get a prior approval, your doctor or the pharmacy. Usually when it's the pharmacy situation, the pharmacist is or pharmacy is submitting a prior approval for your medication. In some cases, they didn't need a prior approval. That will cause a denial as well. If they submit a prior approval and didn't need it, a denial. Or if they submit for payment without the prior approval and it did need it, that will cause a denial. And then we have the 4 prescription for over 19. So if once the person turns 19 and they are over that 4 prescription, that may be a denial because they want to review that and to make sure that, okay, everything is okay, everything is still the same for this person that's now over 19. And then the supply limits, 30 days of a certain medication. So Medicaid will cover sometimes 30 days of a certain medication. If you try to refill that again before, it's kind of like the refill too soon. And also, it's like if you wanted a 90-day supply of a medication, sometimes Medicaid will only cover 30-day supply. So if you try to get the 90-day supply, that could cause you to also be denied. How to avoid some pharmacy denials. Call your MCO plan or health benefits hotline to find out if a prior approval is needed. As we said before, some things may need a prior approval, some things may not. But if you call ahead of time, this can keep you from having to go through the denial. Call your plan to find out the refill limits, as we talked about in the previous slide. There may be some refill limits, maybe only 4 prescriptions. So yeah, if you call and make sure you'll know what to do so you can avoid getting that denial. Ask your doctor to submit a prior approval to Medicaid or your MCO plan. Your doctor can handle that. He will handle that to submit that prior approval to your Medicaid or MCO plan. Make sure your pharmacy has your most current and correct insurance information. As we said before, that's the simplest thing you can do to make sure you don't get that denial. Make sure they have the correct information. And if your child turns 19, ask the pharmacy if a prior approval is needed for the medications they're getting if they're over 19. Okay, what to do? So you get a denial and you're wondering what can I do about this? Am I gonna be able to get the medications needed? First step is to ask the pharmacy what denial reason they are getting. So they could be getting, may not even be a real denial. It may be that they need additional information and they will know those codes. Ask them, okay, what denial reason did you get? They can tell you, and then you can go from there. You may need to call the doctor and ask for something. You may need to ask for a different prescription, like we talked about with the formulary list. You may be something where you have to call the doctor and say, hey, Medicaid wouldn't cover this. Can we talk about an alternate prescription or medication that can do the same thing. Call your MCO plan or the Medicaid Health Benefits Hotline. That's very good idea to always call them. Always call your MCO plan. They can give you a lot of member services, MCO plan. They can give you a lot of good information. The Medicaid Health Benefit Hotline also as well. Call your doctor to get their help. Maybe you may be able to suggest, like I said, alternate medications or resources. You may be able to talk to your MCO or Medicaid to give them more medical information. A lot of times they might just need some additional information. They might need that letter of medical necessity. And now we're going to go over a little example of a walkthrough of a pharmacy denial. So Dr. Jones prescribes Keppra for your child for seizures. The office sends the prescription over to Walgreens. Walgreens calls you later to tell you that the medicine was denied, and to get the medication, you will have to pay out of pocket. The pharmacist you have, well, you tell the pharmacist you have Meridian MCO. Pharmacist confirms they billed the correct plan and it was denied. Ask the pharmacy, what the denial reason was. They say no prior approval. You call Dr. Jones' office and ask them to put in a prior approval for the Keppra. So that is just an example of what we see and what you may experience when it comes to your pharmacy denial.
All right, and now, thank you, Renee. I'm gonna talk a little bit more about some common equipment and supply denials. And I will say kind of some of this stuff is gonna be a little bit repetitive. And I also think sometimes these things happen behind the scenes and get resolved sometimes without even our knowledge, right? So, you know, there's been plenty of times when I've put in a prescription at Walgreens and I have the app and I go to check and it says like insurance pending, and I know Walgreens and my doctor are probably working on something together, and you know, if it goes through, great. The problem comes when something like that doesn't go through, and then you have to kind of come in and say, okay, well, what's going on, and start, you know, kind of interrogating everyone and figure out, you know, what you need to do about it. So just know that not every time is something like that going to happen where you're going to have to work through it. But when it does happen, it's important to kind of know some of the language to use, the questions to ask, to kind of feel informed and maybe empowered to ask those questions. So some of the things that we're going to talk about for equipment and supplies in particular overlap quite a bit. But the reason I wanted to separate them out is because obviously equipment and supplies are very different things. So equipment is things, you know, like a bath chair, a wheelchair, a stair climber, some of those things that we've already talked about. And, you know, supplies are handled in a very different way. So some of the stuff that we've already talked about, I'm not going to go maybe too in depth with, but I think some things with equipment that's important to talk about is that idea of the less costly item available to meet the need. There are, you know, lots of situations, and I think maybe Gracie had said this, like a bath chair, where there's a standard bath chair that I think Medicaid pays like $100 or something for. Very simple, bare bones, not very specialized. You know, it likely meets the needs for a lot of people. But if your child or you have very specialized needs and a more specialized bath chair is needed, a custom bath chair is needed, you know, then that might be appropriate. But Medicaid doesn't like to pay for things that are more costly. So a lot of times you're really having to make the case and working with your doctor to make sure that they write a really good letter of medical necessity to kind of prove why your child needs the things that they do. And I'd say a lot of this comes down to how great your doctor's letter of medical necessity is, how great their medical justification is, kind of what notes you can have them pull in, you know, other people, like maybe a physical therapist, that kind of thing. A lot of it comes, you know, down to being able to provide that information. I always kind of say that, you know, when your insurance is getting the information, so in this case, when Medicaid's getting all of the information in front of them, if a prior approval is submitted, and they're reading all this stuff, you know, they don't know you and your child and your family situation. They only get to see what's on paper. They only get to see what's submitted in the claim. So you really have to paint a good picture for them, and hopefully, you've got a good doctor team to do this, a good, provider team to do this, but they have to really paint a very good picture of what your child needs and why they need that. Because otherwise Medicaid can't just pull things out of thin air. They don't know the ins and outs of what that bath time routine looks like for your child and why it's so unsafe and why it's so hard to, bathe them in the current situation. So painting that picture is really important. So some of that is where that additional medical justification kind of comes in. That equipment being duplicative, we kind of talked a little bit about that before. A lot of this comes down to mobility devices often. Medicaid doesn't really like to approve things like that they see kind of as duplicative, like a wheelchair and a feeding chair, or a stroller and a wheelchair. Medicaid's in the business of paying for the least amount of items. They do have very comprehensive coverage, but they're in the business of, there's insurance. So they don't want to overpay. So they want to make sure that they're not, approving two of mobility devices for everybody. So they really have to consider that. In most situations, they will deny because they only want to maintain one mobility device. Meaning if you have a primary wheelchair and something on it breaks, but they also know you have a stroller, they only want to maintain that one mobility device. So if that wheelchair is the primary mobility device, they want to pay for the repairs on that. They don't want to have to be maintaining a stroller and a wheelchair because that gets very costly. Another thing sometimes that we see is that what's kind of written on the script or the order from the doctor doesn't match the documentation that's been submitted, like the prior approval or the letter of medical necessity, like what the doctor or the provider actually filled out. There's something that doesn't line up, and Medicaid they don't usually like flat out deny it right away. They'll kind of do what they call return to the provider for more information. And they are just trying to figure out, why this doesn't match, what is the right information. So a lot of times providers might say that something was just denied, but maybe it wasn't denied. It was just returned for all of these various reasons. They need more information. Something's not matching up, that kind of thing. And then the convenience thing, I do want to kind of talk a little bit about. It's hard because a lot of the items that Medicaid might see as a convenience, we all might know is not necessarily convenience. No one wants to have some of these, medical devices in their home or wants to need them, but they can be very helpful in making sure that you're able to care for your child. And so a lot of times they see fully electric items as a convenience because they see that it's, something that's easier for the caregiver and not necessarily a true medical need for treating a medical condition. So that line is so thin and so hard to, kind of walk that line to be able to prove what's medically necessary. But like I said, a lot of times those strong letter of medical necessity, sufficient, documentation as far as why this is needed is really important to kind of make that case. Okay, so some of the stuff that we already talked about is kind of similar. Ask the provider if a prior approval is required. A lot of these DME companies, they work with this stuff all day long. They have a pretty good handle on what requires a prior approval or not. But I always say to question them too, right? So if they are saying something like, oh, Medicaid just doesn't cover that. I mean, question that, but I also know that they know a lot about, what prior approvals they often submit. But you can always check yourself. So you can call your MCO, call the health benefits hotline. If you're with DSCC and you have a DSCC care coordinator, these are the exact kind of things that you can bring to DSCC. So talk to your care coordinator and say, we're trying to get a bath chair. Does that require a prior approval? Or we're having a hard time getting a bath chair. Can you help us with that? Those kinds of things are what DSCC care coordinators are here for. You can ask the doctor to provide that letter of medical necessity that's detailed. A lot of times the doctors don't know a ton about what they need to write about. I've had my own experiences with my own doctors where they just don't really know insurance that well. They went to medical school. They didn't go to insurance school necessarily. They have a working knowledge of it, but they're not the experts on it. So they may write what they think is the bare minimum that needs to be in the letter for kind of explaining what's needed. And you might have to work with them to say, this isn't really detailed. We need more information on why my child needs this because, we want to make sure that insurance approves it. For certain equipment, there may be a minimum of time to wait until you can get that same item again. I think I had put in here maybe an example before about like a mattress for a bed. So if you have a hospital bed, you can get a mattress. I think it's like every 2 years. So usually in those things, kind of situations, you're kind of just running up the clock. There may be some circumstances where you can have your doctor or your provider submit a prior approval to kind of say, you know, we really need this before that time limit is up, and here's why. But if it's just that you kind of want another one sooner, they're going to say no unless there's, you know, a real medical justification as to why you would need something before that time limit is up. Otherwise, they kind of set some loose time limits around different items until you may be able to get that item again. And then you can always talk with your doctor or the equipment provider about alternative options if something is denied and you've kind of gone through the process of saying, well, did we provide enough medical justification? And if that answer is yes, and Medicaid's still denying it, you know, you can then have some conversations about, okay, well, if we don't have this item that we really need approved, what are the other options? And kind of just talking through those with your doctor to see what options might be out there. So oftentimes your provider is going to get the letter that shows the denial first, or they may get a call from Medicaid or someone to kind of explain. They may have like a portal that they're viewing for some of the managed care plans, so they may be able to see pretty quickly why something was denied. So they may have that information first. You should also get a letter in the mail if something was denied to explain, you know, why it was denied and if there's, you know, additional information needed, that kind of thing, what, you know, what's needed. But also, I think calling that provider or that doctor first is probably going to be the fastest way to get information. And then, you know, kind of asking them to follow through on those things. Your doctor can do a peer-to-peer review with your health plan to kind of, it's kind of like an appeal on their side first, just to see if they can kind of talk with the health plan or Medicaid's physicians to kind of say, hey, this is really needed for my patient, here's why. But otherwise, you know, you may have to go through the appeal process yourself. So this is just another kind of example. We're going to walk through examples after each of these, but Dr. Patel prescribed an electric hospital bed for your child. Dr. Patel also writes a letter of medical necessity to explain why the bed is needed. The equipment company that you're working with, Hospital Bed Plus, tells you that the bed was denied. And the reason that is it's a convenience item and a less costly item could meet the need. So when you go back and review with your doctor, Dr. Patel says, you know, maybe just a semi-electric hospital bed is, you know, could meet your needs, and she prescribes that. And a new request is submitted for that semi-electric hospital bed with the additional information from Dr. Patel, and the request is approved. So in those situations, kind of working with your doctor, taking the information from Medicaid on why something was denied, and trying to see if there's another option that could meet you or your child's needs. All right, now supplies. Supplies, a lot of this is the same. So what I'm going to kind of I think focus on is the idea of when a prior approval is needed or not needed. So for supplies, there are also situations where a prior approval is not needed because the amount that you're requesting. So when we were talking about what Medicaid covers, we gave the example of diapers, and that diapers are covered for children over 4 as long as the doctor, you know, writes a script and there's a medical need for that. You could get 200 diapers every 30 days, essentially, like no questions asked. They're not asking for additional medical justification for that. If your child needs more than 200 diapers every 30 days, so more than 200 diapers a month, then that's a situation in which a prior approval is needed, and Medicaid's going to ask for a lot more justification to prove why more than 200 diapers is needed, why the 200 is not sufficient. So that's kind of the example that there may be situations where something is denied because someone submitted a prior approval and it wasn't needed. They're not saying they're not going to cover it. They're saying this prior approval is not needed. Don't send it to us. And so it kind of goes both ways, where sometimes a prior approval is very needed and sometimes it's not needed. So if you only needed 150 diapers and your provider went and submitted a prior approval, it would get rejected because there's no need to submit it because it doesn't require one. So just kind of know that. Sometimes providers, I think, can get confused and maybe say things in a way that makes it sound like something was denied. A lot of times, like I said, I think they're the expert because they experience these things a lot and they're providing services to a lot of people. But sometimes they just seem to word things from their, you know, the information that they get from Medicaid in a way that makes it sound like something's not covered. The other thing is when the prescription doesn't match that prior approval or letter of medical necessity. We've seen this recently with some things that we've worked on, is that in the letter, I think it said something about a certain number of catheters that was needed, and then what was actually in the prior approval was a different number. And so Medicaid kind of came back and said, you know, this is not all adding up, which is it? And so little things like that can hopefully be corrected pretty quickly if it's just, you know, a typo in the letter or typo on the prior approval. And that's where some of this stuff comes down to such small details, because that can cause the entire thing to just be denied and make you wait and make you feel like you are not getting something approved. And it's really not necessarily Medicaid that's taking a long time to make a decision. It's just that the documentation that was being submitted to them had some errors on it. So to avoid some supply denials, you can call the supply company and ask them if prior approval is required. Again, you can verify all this information with your plan or with the health benefits hotline or with your DSCC care coordinator if you're with DSCC. You can ask if there's a limit on the number of items you can get. Like I said, that example with diapers. So if you only need 200 every 30 days, you're within the limit. If you need more, then you know that a prior approval is going to be needed. And just also know that those age limits or other criteria that needs to be met could kind of play a role in what you're allowed to get. If your child is 2 or 3, you're not going to be allowed to get diapers because it's considered still like a developmentally typical age where someone could need diapers. But once they're age 4, you can talk with your doctor about writing, a prescription if that's something that your doctor feels that your child has a medical need for. So just things like that, examples like that, where that age limit and other criteria will come into play. And then really writing that letter of medical necessity. And that may, take some coordination with the whole team, which again is another thing that DSCC could help with. You can ask your care coordinator, say, I'm really having a hard time getting the doctor to write something that's detailed or getting the right justification from my medical team. DSCC can kind of help advocate and connect all of the team and make sure that that information is detailed. Okay, again, that supply company or the doctor is probably going to be the first one to receive the denial paperwork. So call them and ask why things were denied. They usually will have that to be ready to go and be able to give you a little bit more information on what happened. But otherwise, it is kind of calling your MCO, Medicaid to kind of figure out what happened. But the same situation with the equipment is that your doctor could do a peer-to-peer review with your health plan and or the Medicaid doctor and say, this is why my patient needs this, and see if it might be reconsidered by the doctor reaching out and having a conversation. All right, so our final example about supplies here is that Dr. Garcia writes an order for Foley catheters for your child. The order says that your child needs 30 catheters per month because the catheter needs to be changed once per day. The supply company, Best Home Supply, says that they cannot bill for the catheters because the limit is 2 per month. And this is what I was saying, that sometimes providers will give information it's not wrong. I mean, it's true that, 2 per month is the limit. But what we know is that Medicaid could consider more with a letter of medical necessity. So you request that letter of medical necessity from Dr. Garcia and ask Best Home Supplies to send a prior approval to Medicaid. When Medicaid gets that information, they can review it and the request for the Foley catheters and approve it. So that's obviously the best case scenario, right? Some of these don't go that simply that, it just happens seamlessly in a day kind of thing. Some of them, take a little bit more time and work, but that's kind of the process. We wanted to explain what the process would be to get something like that approved. And if you're hearing a no from the provider or doctor, things like that, you can question those things and, hopefully have an outcome where you get the supplies that your child needs. All right, I'm going to turn it over. Our final section here is about a bill. So obviously, if the denial thing is what happens and you're not successful with overturning it, it turns into a bill. So Renee, I will turn it over to you.
Okay. Hello again. We are going to talk about a bill for a second. First, we're going to talk about what is a bill. And most of us do know what those bills are. But a bill concerning when it comes to our Medicaid and things of like that, a bill is a statement of charges for medical services. So say a bill can be submitted to the insurance company, and once the bill is submitted to an insurance company, it's called a claim. So a claim lists the services your doctor provided. It also lists the date of service and the charges. The insurance company uses the information given in the claim to pay the doctor or the facility charges. Okay, now what to do if you get a bill? If you have a question or concern about the bill, call your medical provider. That's the first step. Ask them to explain the charges. The provider may need more information. Sometimes they may need, again, as we talked about earlier, they may not have your correct Medicaid information, so they may need more information. Medicaid or managed care plan might have denied the services, so it may have been something they wouldn't cover. If the provider accepts, remember this, if the provider accepts your Medicaid and the services are covered by Medicaid or by your MCO, your managed care plan, the provider cannot charge you. They cannot charge you the copays. They cannot charge you a coinsurance or a deductible. They can't say, hey, I wanted $100 for this service. Medicaid only paid 80, so I'm going to charge my patient the additional 20. Nope, that's against the law. They can't do that. That's a federal regulation that they are not allowed to charge you that extra. If they're enrolled with Medicaid and they said we accept Medicaid's payment, whatever it is, even if they seem like it's too small or whatnot, they still cannot charge you the additional. Okay. If you don't agree with the bill, you can dispute it with the provider by calling the billing department. Again, it is very important to pay attention to your bills and not just pay them. Sometimes if it's maybe $10 or something, we'll say, oh, we'll just pay that. No, don't just pay it. Find out what it's about. Also, when you call that provider's office, you can request an itemized bill. You can find out everything they charged for. Okay, so now we're going to talk about the appeal. So you've received the bill, you've talked to the doctor's office about it. They're saying, nope, you owe this. Now it's time to appeal. If Medicaid denied the services, and you have that right to appeal. An appeal is when you ask Medicaid or your managed care plan to reconsider their decision. So the doctor submitted for your service for payment, Medicaid decided we're not going to cover that. Your managed care plan, we're not going to cover that. You don't agree with that? You can appeal that. If you have regular Medicaid, no managed care, you submit your appeal to Medicaid. If you have Medicaid, again, if you just have regular Medicaid, you're not in an MCO, you're not in the Aetna or Meridian, County Care, Aetna, none of that, then you always submit your appeal to Medicaid. Now, if you're in a managed care plan, like one of them I just named, then you submit your appeal to your plan by calling member services. Now, usually you have a time limit for submitting your appeals. So usually it's within 60 days from when they deny the service. It is very important to meet this deadline. If you do not meet this deadline, you won't be able to appeal or dispute the bill, and then you'll be responsible for it. And we also did this training on appeals last year. It's on our website, so please go back through that, and it gives a lot more detail on how to appeal and just gives a lot of good information on that. Okay, now these are some ways that you can appeal when it's Medicaid. You can appeal online through your abe.illinois.gov. Okay, you can write a letter and submit it one of these ways at your DHS Family Community Resource Center. That's your local office. You can call the DHS helpline. You can email dhsbah@illinois.gov. You can fax it in to this number here, 312-793-3387, or you can mail it to the Bureau of Hearings, and this is the address for that. Make sure you keep a copy of whatever you submit. Keep a copy for your records. Okay, let's see. Let's go to some tip sheets or some resources. We're going to talk about here some resources and some links. We have the DSCC Appeals Tip Sheet. We have the DSCC Insurance Appeals Calendar. We have the DSCC Appeals Communication Log. We have the What Does All Kids Medicaid Cover Tip Sheet, which Gracia talked about. We have Health Choice Illinois, a Medicaid Managed Care website. Also, just a summary, of what we talked about. Denials are when your health plan says no to an item or service. Medicaid covers many services, but you may need a prior approval. Again, you may need a prior approval just before you have that service, or if you get that service and it's denied, it may have been because you didn't have your prior approval. Information from your doctor that supports the medical needs is very important. So your letter of medical necessity. This is when, you get that denial that says, okay, this wasn't medically necessary, and you have your doctor to give the proof that it was. Pay attention if you get a bill and be sure to review it. Remember, don't just pay it, even if it's a small amount. If you don't agree with the decision that Medicaid or your managed care plan made, you can appeal it.
All right, and I'm going to go to our final slides, and then we'll come back to questions since we're already past time technically. If there's anyone that needs to hop off, I wanted to just kind of wrap up real quick. Okay, so just thank you all for being here tonight and participating in our training. I know in Northern Illinois, we had a beautiful night tonight, so the fact that you all were willing to jump on here and spend some time learning about insurance means a lot. We hope that you found it helpful. We will be emailing the link to the website. You'll get it in an automated message from Zoom, but it'll have at the bottom the link to the website where all the materials and recordings will be posted. The recording will usually go up in the next couple of days, but all the materials are already there, so you could go and review the slides, the tip sheets that we talked about, all that stuff's already on the website. At the end, when you close out of Zoom, there'll be a survey that pops up. Please complete that, share some thoughts if you have any about, trainings that you'd like to see in the future. We want to know what's most helpful for you, so that when we do future training sessions that we're really covering the topics that are of interest. And then our last webinar for May here. So this is a 3-part series. In March, we had Social Security benefits, which was also recorded and is available on our website. We're doing this one right now, which is the Medicaid denials. And then in May, we're going to talk about transitioning health insurance to adulthood. So if you have a child that's going to be nearing adulthood, which even could start as early as, 12, 14, that kind of age range, if you're planning ahead, we're going to talk a little bit more about what happens when your child becomes an adult and what kind of things to think about for health insurance. And then finally, that's just the link for the webinars. And then this is our contact information. So again, if you're with DSCC, you can definitely reach out to your care coordinator. They're very familiar with who we are as a unit and what we do. So usually they'll get linked up with us if they need to. But you can also send a general email to the DSCC email. That's just dscc@uic.edu, and they'll direct it to us if you want to put something, question about the training. Okay, so I'm going to stop sharing so that I can actually see the Q&A because I can't see it right now. Okay, so someone had a question about if the referral can be provided by any of the doctors, specialists that treat your child, or does the referral have to come from the pediatrician? So kind of depends. And if it's like a referral for a specialist, that's going to come from your primary care doctor. But if someone is writing an order for, a piece of equipment, that could come from a specialist too. So it kind of just depends on what the need is and where that need is coming from. Like if it's something that came up in, talking to an orthopedic surgeon or something like that, they may be the ones to write a referral or an order for something. Okay. Someone said if we asked if we could talk about how to handle Medicaid providers who won't accept Medicaid as secondary. To be honest, I don't have a ton of like great advice for you on that one. You know, we see it from time to time. I will say it's their right to not accept Medicaid. Some providers are uninformed that they could enroll with Illinois Medicaid, but not have to accept every person that has Illinois Medicaid. So you could talk with them about that. There might be a situation where, you know, maybe they're willing to accept it for, you know, you and your child because you have it as secondary insurance. That may be a conversation to have with them, kind of say, well, if you're enrolled with Medicaid, you know, you're not going to have to see every Medicaid patient, you know, that walks in the door. It's really just so that they could be enrolled with Medicaid to make sure that Medicaid kind of clears them as their credentials and things like that. So that's maybe my best advice. If you wanted to reach out, we could definitely set up a call and talk a little bit more about your specific situation. I'm happy to do that, but I think that's my best advice kind of in a general sense. Okay. Someone asked why, even with a prescription, are so many of us having pharmacies put through successful claims for things like Miralax, Senna, etc. It's my understanding that with a script, we should be covered. We have been seeing that a little bit more where this is kind of basically saying, why is, even if your doctor's writing an order for something like Miralax that is technically considered an over-the-counter item, like why is that being denied? And I don't 100% know right now. Honestly, I know some of it has to do with, you know, the end of the public health emergency. I know that we're almost a year past that now, but during the public health emergency, Medicaid was much more lenient on prior approval requirements. So some of those things weren't required. And since the public health emergency ended in May of 2023, those requirements kind of have been turned all back on. And we're seeing a lot more denials for things that are related to over-the-counter medications. I have seen that some of it has to do with the pharmacy not billing correctly. That there is a way for there to be like an override put in place, but that the pharmacies just maybe uninformed. You know, there's been a lot of staff turnover at pharmacies, you know, within the pandemic and still today. And so I think that's kind of most of what I'm seeing that's been happening. But I do think if you're with DSCC, if you're a part of the waiver program and you're with DSCC, please bring those things to your care coordinator so that they can get to me, or you can even ask directly for them to ask me about it if you need to. Those are definitely things that I want to keep reviewing, but you're right in the sense that we have been seeing that a little bit more, and I don't have a 100% answer on why it's happening. It was kind of a combination of all of those things. Someone asked if there was a limit number of hours for physical therapy with Medicaid, and no, there's not technically a limit of hours for therapies. They do require like a review, sometimes usually like notes to be submitted on some kind of running basis, like every 90 days to kind of prove ongoing that there's still a care need for an ongoing therapy needs, but there's not like a set number. Kind of like with private insurance, you might have, you know, like 60 visits a year or something like that. That does not necessarily exist through Medicaid. Someone asked, they said that they have a manual bed for their son and that they've had it for 10 years and want to know when they could ask for another one if their son has grown and is outgrowing the bed. So I think that's a great example where I would, you know, talk to your doctor about writing an order for a new bed. Sometimes Medicaid will say, let's modify the current piece of equipment or, you know, whatever exists if they can. So if there's a way that they could modify the bed for it to still work, they may, but otherwise they may just approve, you know, a larger bed or a new bed based on the time that's passed and perhaps, you know, the growth of your child. So I definitely think anytime you kind of see those things where your child is outgrowing something and it's medically not, you know, meeting the function that it should anymore, or maybe a safety hazard, definitely get in touch with your doctor and a provider about submitting for a new one. All right, got 2 more questions. Oh, can I submit an appeal to a prior auth denial for a prescription? It sounds like there was a prescription for a specific medication for eyes and it was denied. And it seems like maybe you're not getting some help for your doctor. Yes, you could submit an appeal to Medicaid for that. You'd have to kind of know when it was denied though, and if it was kind of based on that timeline for being able to submit that appeal. Like Renee said, you can appeal within 60 days. And so if it's been longer than 60 days, the appeal timeline has passed. So you might need to have it kind of resubmitted. I know if your doctor's not, being very helpful about that, that's kind of tricky. But at least if they might be able to kind of run it through again, like resubmit it and you could get a denial, you might have that opportunity to appeal. But if you're with DSCC or if you want to share some specific information with me, we could try to look into that and kind of figure out a little bit more information about what is going on with Medicaid to see what we could do to kind of help get more specific details. I think I've answered all of the questions that we have at least received. Is there any other questions that people wanted to ask verbally before we go? If you want to ask the questions verbally, you can just use the raise hand button and I can unmute people.
Hi.
Hi.
I have a question regarding benefits for my daughter. She have the Blue Cross community, and we keep having problems with their covering her like physical therapy. Only would give 10 visits and then they would deny more. Even the doctors, all her specialists, she's in a wheelchair.
Okay.
They keep saying peer review and all this stuff. Is there a way where this could be addressed, not as a that she needs it and all the doctors are saying in there, but we keep getting denials and we have to wait whole 7-8 months, start over, and so on.
Yeah, I mean, if you want to send me some specific information about, maybe your child's name and your child's I think you said the plan, but some more specifics, or maybe we could set up a separate call to talk through what's been going on. We definitely would love to take that back to Medicaid and learn a little bit more about why it's being denied.
Okay, they keep saying that it's not necessary, or the caregiver can do that for her, or whatever maintenance, even though really we have to have that support. Okay, we will go. Thank you.
Thank you so much. All right, so that is the end of our questions. So that'll conclude our webinar. So again, thank you so much for being here with us. Have a good night.